Legislative Advocacy Advisor for the Alliance for the Treatment of Intractable Pain, or ATIP, and I'm also a patient with intractable pain suffering daily from a degenerative autoimmune disorder. ATIP reaches over 30,000 individuals daily and has a social media presence of over 100,000. We do not accept any donations from industry or members and are entirely self-funded. ATIP exists to protect the relationship between patients and their healthcare providers. We believe all medication and care decisions should be made by private healthcare providers and their patients in a compassionate and ethical manner, guided by regulatory standards. First, I want to thank all of the members of the Ohio Board of Medicine today for their work on the proposed Ohio subacute and chronic prescribing guidelines. It was clear to me, after careful analysis, that in crafting these guidelines, the board took a very nuanced approach and included significant stakeholder input. I'd really like to thank you for that. I would also like to offer a few thoughts on a possible solution for long-term pain care patients in Ohio. Recently, various efforts have been made by states to try and mitigate the addiction and overdose crisis, and Ohio has led the way in this regard. As a result, however, a troubling trend has arisen that is destabilizing and harming pain patients across the U.S. and even throughout Ohio. This trend involves government bodies rewriting, over-regulating, or restricting the prescribing of controlled substances for the management of chronic non-terminal pain. Pain patients in Ohio are already suffering immensely from undertreated and untreated pain as a direct result of current policy changes. We believe that requiring PCPs to consult a board-certified pain specialist for chronic pain patients is unrealistic. Intractable pain patients' numbers far exceed the actual number of available pain specialists in Ohio. Because of this, we are concerned that more primary care providers might choose to opt out of treating chronic pain altogether. We are already seeing this happening at an alarming rate all across Ohio. To address this troubling trend, we suggest adding palliative care and hospice providers to the list of specialists available for PCP consultation in treating chronic pain. In so doing, you can double the amount of specialists available to consult with primary care providers in treating long-term pain. In working with federal and state policymakers and healthcare providers to find solutions that ensure continuing access to all rational, evidence-based therapies to treat chronic non-terminal pain, ATIP developed an initiative called the Palliative Care Exemption Certification, or PCEC. This was based on Maine's successful exemption as of July 1st of this year. As part of the CDC's 2016 guidelines to treat long-term pain, they offered the following exempt categories, 1 being hospice, 2 cancer and post-cancer, and 3 being palliative care. Our initiative utilizes the CDC's palliative care exemption in order to safely treat long-term intractable pain patients. The PCEC provides protections for providers who prescribe controlled substances and the pharmacists who dispense them. It offers a way for PCPs to develop individual plans of care for legitimate patients using clinical knowledge, experience, and patient response, while exempting them from disciplinary actions if they're acting within the exemption standards and policies. The PCEC creates a template that guides all providers when initiating, maintaining, and evaluating opioid and other therapies. The palliative care exemption provides a system to coordinate care with all providers, including the pharmacy of record and insurers. Most importantly, it protects patients from abandonment, arbitrary dose limits, and denials of emergency and/or pharmaceutical care. ATIP would like the Ohio Board of Medicine to consider adding the PCE to the proposed guidelines. We offer our help and resources to assist the Board of Medicine in understanding how a palliative care exemption could work for Ohio patients and providers, and would be honored to offer our services with future endeavors. Thank you.
Thank you, Ms. Barney.